The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome back to another episode of the Dental Brief. I believe with us today, I'm pretty sure that Dr. Killeen has been on the program. I think this is his 4th time. He might be the reigning champ of guests. So Dr. Addison Killeen, thank you so much for being here today.
Yeah, no problem. That means that you haven't kicked me off the show yet. So that's good. I appreciate it.
Not yet. And I think that you can probably hold this title as much as you want. I know in my office, I have one that I've read cover to cover, a few that I've read what I wanted to read at that time, but you have some amazing content that you've put out there in the form of books. You've got dental operations manager, front office manager manual. You've got excellent book on marketing, startups. What haven't you written a book in dentistry about yet?
Well, dental assisting. So yeah, that's my next one.
So that's coming out soon.
Yeah, maybe 3 to 4 months. Yeah.
Fantastic books. You can get them on AddisonKilleen.com. There's links. You can find them on Amazon. Well done. And thank you for contributing. So I get what I was getting to with that is a good plug and promotion for you. And people should certainly check out the books. But I don't know that anyone's going to be able to come up with the amount of content that you've generated in your career as a dentist. So thanks for that.
Oh, thank you.
So people can go back, check out the story, how you became a dentist. You own multiple successful practices in Lincoln, Nebraska, correct?
Yeah. So pretty much. Yeah. Started in dentistry 12 years ago, got into one practice, built it up to 7 and then sold out. And now it's been 4 years in August in the startup, quote unquote startup. And now we're up to 4 dentists, 11 operatories, and doing another construction project soon. And so, it's kind of an interesting change of model up to a big practice, but I still do lots of, coaching calls with dentists and talking through different weird scenarios like, should I start up a practice here? Should I buy a practice there? And they're super fun stories and interesting problems. And so I love kind of working through some of those with those, members and clients just to help them figure out what's the best way forward.
Yeah. So I know you're a by the numbers guy for sure. I think you even have a book that has that in the title. Am I right? Am I correct?
Exactly. By the numbers. And I've had somebody quit on me telling me that not everything is by the numbers.
Yeah.
And I said, well, I'm one less hygienist now.
Well, I think that there's interesting enough when we talk about buying practices, right? BUY, the numbers. I think there's a lot that can be said there, but I think not all practices are numbers when you're talking about acquisitions. Is that a fair statement or no?
Yeah, there's so much kind of, the accountants will use the term blue sky. And the blue sky is all the unmentionable or undescribable aspects around a practice that, it's not on the P&L. It's more about, the location, the longstanding nature of the clientele. What sort of dentistry was the previous dentist doing? Even the flip between whether they're fee for service or take a lot of insurances with PPOs, those sorts of differences, which there's a lot to navigate through. And so the same practice on paper might have 2 wildly different values if you start changing some of those other variables.
Yep. So here's, I think, what I'd like to talk about today, and knowing that you do a lot of consulting in the acquisition space and the startup space. I think something that I would like to talk about is how to go by the numbers and not get emotionally involved, because I think blue skies become brighter blue and they become much bigger when somebody has some confirmation bias, or maybe they've had 3 or 4 deals on an acquisition build out. All of a sudden you're like, hey, I'm going to pay more for this and stretch because of this XYZ blue sky. Do you see that? Do you get that phone call? Do you answer that?
Oh, yeah. And part of it, sometimes we hear stories, and we try to put ourselves into the stories of other people. So they, you hear a friend that did a startup or an acquisition and they bought this type of practice. And now 3 or 4 years later, they're doing amazing. And you look and like, well, this practice, it's the same, it's doing 600 in revenues. And now I'm going to take it to 1.2 million in 3 or 4 years. and it's, kind of the same. Maybe it's not on the corner that guy had, but it's close to the corner. And so, yeah, even though the practice is asking more than market rate for that acquisition, maybe you say, well, like, I'm okay paying that because I know I'm going to make it up. I know I'm going to get 1.2.
Right.
And I think the biggest thing that when you're looking at these acquisitions, and, obviously there's a lot of, I'm sure your listenership who is maybe in the associate position right now and is going to make a jump to buy a practice. But if you already own a practice, you're not out of the market, because you might have empty chair time and their guy down the street is selling, and you're going to like absorb his practice or her practice. So, I mean, you can make an acquisition at any time in your career, and it could actually be a very good business move.
Sure.
But you can't make too many assumptions based on what, like, case studies of other people's success. You kind of have to go with, like, you should always fall back to the average. And, like, what is the average patient retention? What's the average distance you could move a practice without losing a significant amount of patients? The average staff retention. For the most part, I have yet to see more than one employee I've purchased 7 practices, and out of the 7 practices, probably on average 5 to 6 team members per practice. We're talking close to 40 team members here. And I've had one stay with me longer than a year after an acquisition.
Yep.
And so the average is that you're going to lose all the team members, which is great, because that on your P&L, that line item will change, and it'll change back to market rates, whether that's up or down potentially. We generally see a lot of older doctors who pay a lot for their team members, which is great. They've been very generous to their team members. But even if you match that pay rate, you're coming in as the new guy, and you're asking them for all, like, well, I never cleaned the bathroom when I was with Dr. Jones, and now you're making me scrub toilets. And there's often hard feelings, no matter what, no matter if you're a great boss and everything, it's just different. And so a lot of those things can change, which is good. But I think you have to kind of reset all of your assumptions about what the price should be. And having good advisors in this process is huge, because people that have enough pulse on your market, your pay rates, and what is average in your market is kind of the base of what you should do.
Yeah. When you talk about blue sky, I'm not in the accounting side or the banking side or the transition side, so I only know a little, is what I'm getting at, right? But one thing that I see that people don't talk or get excited enough about, at least I don't hear it on my side of things, is when they can buy a practice that has a really nice piece of real estate that they can opt into buying as well. That's affordable, that makes sense, that's going to generate around a wealth. And to me, that's some great blue sky that sometimes doesn't always go with the practice valuation, right? That isn't being talked about. I know a dentist right now that has a successful practice, wants to buy another one, but she only wants to buy where she can buy the building too. She can't buy the building. She's not interested. And it makes sense, right? Otherwise, she needs to do a startup again, and she knows how painful that can be. Although it can be right for some people too. What's some blue sky like that sometimes what's a secret that people don't always look for, that the accountants, the banks, that people don't look for, but that's real?
Yeah. I mean, it's where you're getting a steal, where you can, like, those metrics of buying something where somebody hasn't put a value on it yet, or you don't have to pay for that value. Sometimes people, if it's street frontage, people sometimes can put a value on that, or they'll try to extract a value. But the purchase, first right of refusal on the real estate, or the ability to buy the real estate, that's a huge one. Just unused operatories. In my mind, that's actually a huge advantage to an acquisition. If they say, well, we only use 4 ops, but we're plumbed for 7. And, we currently use that 7th one as a storage. Well, okay, 5, 6, and 7, that's another $800,000 in revenue. If you brought in an associate and another hygienist, like that's golden. That's typically undervalued, or that's actually sometimes a detriment to the practice, where they say, well, it's ugly, it's unused space. The ability to grow is just such a big one, because then you might do an acquisition now, and then in a year or 2, you buy out another retiring doctor.
Sure.
It's tough to find those sorts of things, but the other thing in the acquisition space is when you're doing the math, and the accountants will help you through all this, but it's how much value do you assign to the supplies and dental like small equipment?
Right.
How much do you assign to the big equipment, chairs, sterilizers, pumps, whatever, the furniture fixtures, and, all the interior stuff? Those things you get to depreciate instantly. So that
Right.
has a better tax bang for you. So sometimes the same price, $1 million practice here and $1 million practice there, has significantly different values to you as the buyer or the seller based on their tax advantages of assigning. So sometimes, and one of my buddies was buying a practice recently, and it was the real estate and the practice. And I basically said, hey, how about you decrease the price of the practice, pay more for the real estate. This dentist was moving from New York to Florida, becoming a southern bird down there.
Yep.
And basically I said, use a 1031 tax-free exchange so that they could then go buy the real estate they want in Florida to do retirement planning, whatever.
Sure.
It helps you it doesn't really cost you that much more, but it helps them to a significant degree. Yep. And so I said, how about it's the exact same price, but for them, it makes a better deal. So there's all those little tweaks that, usually your advisors like accountants and lawyers will help you work through.
Well, ironically, I know it seems crazy, but paying more for real estate, and it actually raises the value of real estate all around you. So you're actually increasing your value, maybe artificial, but you're literally increasing the value of real estate around you. Now, you can't do that on purpose, right? You can't go out and purposely inflate values to purposely bring up the price of real estate, but it certainly happens. Dr. Killeen, one thing that I see happen that always scares me is when somebody's doing a startup, and the reason why they're doing a startup is because they couldn't find the practice that they wanted to buy, that they had in their vision, what they wanted their practice to look like. And usually it's about equipment, it's about look and feel, it's about granite countertops, right? Or they're like Formica. It's usually those types of things. Might be the way the outside of the office looks. A lot of it is just aesthetics. Some of it is equipment, which can easily be replaced. That's scary to you, isn't it?
Oh, yeah. Well, if you're going to do a startup, you got to be absolutely dedicated to the idea of, I want to start something new in a new place, and that the numbers work out. Not too much competition. There could be a lot of dentists there, but if they're not dentists that kind of do the same sort of work as you want to do, then it's not competition to you. So yeah, you have to a startup is quite hard. There's like hundreds and hundreds of decisions and a lot of debt. It's kind of like taking off a plane from the runway. I don't know jack squat about it. So to learn to take off a plane, it's going to be rough to get up to 40,000 feet.
Right.
The acquisition, on the other hand, it could be an ugly plane, but you're buying it already in the air. Now you have to take a loan out for it. It's the same loan no matter what, but at least you're flying at 40,000. You already have revenues coming in.
Yeah.
And then you can kind of learn on the fly. But a lot of those things in acquisition can be changed. Yeah. Like the upholstery. Upholstery is quite easy to change.
Yeah.
Paint is easy. Floors, carpets, a $10,000 or $20,000 remodel can go a long way.
Yeah.
But at least you're already up there flying and getting revenues.
Yeah. That's funny. It's a funny thing to think about, right? Because I think if we were on a flight and the captain said, hey, who wants to come fly the plane for a minute? I think a lot of people would raise their hand. But if the captain was like, who wants to land this thing or who wants to take it off? Nobody's raising their hand. That's a pretty good analogy. So I've asked you this question before. I'm going to ask it again. There's a lot of great people out there that can help dentists out through all of these different phases of buying, selling, running a practice, hiring everything, right? And there's a lot of help out there that can really save people a lot of time, money, pain, stress. We could go on and on with the benefits. How do you find someone? What are some questions that you ask to help someone vet the right expert to work with?
Yeah. I think just knowing how many previous transactions they've been a part of is huge. How many they've, if it's a dentist that's done it, how many have they owned or sold or bought themselves? Basically just how much money can you save these folks and how many problems can you help them avoid? That's kind of the big things. I've worked with Dr. Mark Costas for a number of years. The Dental Success Institute kind of has a spinoff called the Practice Launchpad. They focus on startups and acquisitions a lot. So that's a great group to be a part of. That then you also get access to the Mastermind. Now the Mastermind is generally for more seasoned professionals that already have a practice. But
right.
yeah, and there's lots of other consultancies out there too that, you just want someone to hold your hand and help you answer the questions. And it's not always cheap, but sometimes getting yourself into a bad situation is more expensive. And so
100%.
kind of paying for help and advice is worth it every time.
Yeah. Mistakes and failure are great teachers, right? But they're really, really painful. Really painful. And a lot of times are incredibly costly. I mean, costly. So one more time, the website is addisonkilleen.com. Check it out. Check out the books. So much knowledge and wisdom that you're sharing. I appreciate you coming on the show one more time, Doctor.
Yeah. Thanks, Patrick.